We have one of BrightView's more passionate addiction treatment and recovery advocates with us here today. We're excited about that to discuss the latest on this important topic. James George is a regional director of operations for BrightView. And as you see on the slide, he has deep experience in the operations knowledge required to help ensure our multiple locations can consistently offer the best possible care to our patients. His commitment to recovery extends far beyond his daily responsibilities, though. He's motivated by his brother's struggles with addiction, and James has dedicated his career to supporting individuals on their journey to recovery. And with 20 years, more than 20 years of leadership experience, he brings a very unique perspective to our conversation today. Next slide. We are in very good hands. And with that, I'll let James begin.
Thank you so much, Kevin, and welcome everyone. It's my pleasure to be with you all this afternoon. So today we're going to talk about SUD trends among Black Americans, issues impacting Black Americans more acutely, social determinants and trauma, why aren't Black Americans seeking treatment, improving care for Black Americans in treatment, and we will end with a question and answer session. SUD trends impact on Black Americans, and we all know that it is a community concern. Part of BrightView's mission, or actually BrightView's mission, is to deliver life-changing addiction care in the communities we serve. So even as our organization, we understand that it is a community concern, even more so than just the individual that has the substance use disorder. The level of public concern about drug addiction is tracked by a 2021 NIH survey shows drug addiction is considered a major community problem. Approximately 42% Black and Hispanic Americans are impacted by this, 34% of white, 20% of Asians. Next slide, please. Impact on Black Americans deals with overdose trends, and specifically overdose trends by race. It showed a shifting impact throughout recent history. So the death rates increased in Black men. Once upon a time, they were less likely than white men to die from drug overdoses. However, in 2020, the overdose death rate for Black men surpassed the rate for white men, having more than tripled since 2015. Rates among men and every other racial group have increased more slowly. The overdose death rate for Black women rose 144% from 2015 to 2021. Next slide, please. In 1973, the state of New York passed Rockefeller laws, which implemented stricter drug policies for possession of sale of heroin in the state of New York. In 1986, we passed the Anti-Drug Abuse Act that involved mandatory and severe sentencing for low-level nonviolent drug offenses, mostly for cocaine. Supposedly, these acts were to be our war on drugs. And with that goal, it was to reduce illegal drug trade in our country. And it has disproportionately impacted Black Americans. Arrests focused on low-level offenders and came with disproportionate sentences and long-lasting consequences for employment and social barriers. And if you think about our country's history, that disproportionate sentence, whether it was incarceration or even if it was in mutilation or even death, has been part of our country's history. So it just continued on that path. Black Americans historically were charged with a significant number of drug-related offenses, while white Americans represented the majority of those with a substance use disorder. As a result, the prison population exploded, and by 1995, nearly 1 in 3 Black men in their 20s were incarcerated on probation or on parole. Next slide, please. The true impact of this war on drug, and it was a quote, "It's like a life sentence. The long-lasting impact of aggressive penalties for low-level offenders extend past the sentence itself, creating multiple long-term barriers. And these social barriers make it difficult to becoming a contributing member of the community. And some of those barriers are employment opportunities, housing options, voting eligibility, custody of the children, impacting the home life, and even education. Next slide, please. Racism and trauma creating treatment disparities. Social determinants contribute to addiction treatment disparities between the races. And some of those disparities are criminalizing people, a lack of trust in the legal system. If you think about what we just talked about as far as the disparities on a couple of slides, creates that lack of trust. The using and selling of drugs as a means of survival. Sometimes in the Black communities, people think that that's the only way that they can become financially sound. It's part of that, without getting too political, systemic racism, and I even like to talk about systemic oppression. It's a way that some people think that they can achieve the financial American dream. Having role models of Black Americans as entertainers or athletes, as opposed to lawyers or doctors or even presidents. That entertainment aspect often glorifies drugs, makes it a little bit more acceptable in the Black community. Social media also reinforcing that misconception. Single family homes not really having enough time as a family unit, and therefore it creates a situation of a lack of supervision. Next slide, please. Adverse childhood experiences, also known as ACEs. Growing up in a home with exposure to adverse childhood experiences is a trauma associated with lifelong physical, emotional, psychological, and social challenges. ACEs include emotional, physical, and sexual abuse, domestic violence, substance abuse within the household, parental separation or divorce, and emotional or physical neglect. Black Americans often deal with trauma internally and are unable to cope. They don't realize there are explanations to why they have a substance use disorder, explanations that can help them cope and recover. It's part of the reason why seeking treatment is so important, so we can get to the root cause of the substance use disorder and be able to treat it from there. Your ACE score. And there is a test that you can take to determine your ACE score. And individuals with an ACE score of 5 or more were up to 10 times more likely to have illicit drug use problems, including addiction, and 2 times more likely to be an alcoholic. Next slide, please. One of the biggest questions while we're all here, why aren't Black Americans seeking treatment? Follow-up question to that is, why are white Americans 35 times more likely than Black Americans to visit a doctor for buprenorphine treatment? Medical racism and abuse has created a mistrust of healthcare. We had, going back to what I was talking about before, systemic oppression in terms of the forced sterilization events throughout the South for primarily the 20th century, from the 1900s into the 1970s. The Tuskegee study, focusing on Black men within the 1930s into the 1970s, and pain management and racial profiling from the 1990s up until the 2010s. In 2020, the American Public Health Association declared racism a public health crisis. Next slide, please. Black men seeking treatment. Another question, why aren't Black men addressing substance use disorder? And we know that those who has an SUD, one of the challenges that they have, regardless of their ethnicity or their background, is a stigma that's attached to it. And with that stigma comes shame. There's also a challenge of dealing with a show of weakness by admitting that you need help. And I actually have a different perspective on that. One of the things when patients are inducting into our program or one of our centers, and if I happen to be there, I offer 2 thank yous. One of the thank yous that I offer is, I thank them for the trust that they're instilling in us, because that trust is going to go a long way towards their recovery. They don't know us from anyone that they've ever met in the past, present, but they will know us in the future. But they're entrusting us, this center full of professional strangers, that they're entrusting their sobriety with. So that's one thing that I thank them for, is that trust. And I also thank them for the show of strength and courage, because it takes an incredible amount of strength and courage for a bona fide grown individual, regardless of their gender, to say, hey, I have a weakness. I can't do it by myself. I need you all to help do it for me or do it with me. So I don't see the getting help as a sign of weakness. I see it as the exact opposite. It's an incredible sign of strength. The weakness is not moving forward towards that recovery that an individual may need. And also regarding Black men, being the patriarch, in that image of the patriarch, that they must appear strong and resilient, self-reliant. I can do this. Sometimes you can't. Sometimes you have to admit that you need help. Some of the other challenges is fear of the criminal justice involvement. In the Black community, if you happen to have an SUD, and because of the relationship with law enforcement or the history of it within our country, and depending on the community that you're in, you see yourself as being a target if you happen to have an SUD. It's another reason why you get arrested. It's another reason why the law enforcement entities will follow you or have you in their sights. Another challenge is seeking a lack of provider or provider diversity. It brings another level of trust. It's not the end all be all of trust, but it brings another level of trust when you see someone who looks like you, who is going to treat you. So that's another challenge. And also likely to have a low sense of self-worth. Obviously, you're not feeling too happy about yourself if you have an SUD. And it could deter you from seeking treatment. Next slide, please. Similar to Black men, Black women also has various challenges and barriers. One of the things that is similar to Black men is that shame and that fear of having that addiction. Involving women as well, it's fear that it could provoke child protective services. Could be economic challenges if you're in a single parent household and that single parent is a woman. If there's even one job, let alone two jobs that they're working to support, seeking treatment takes away from the time at the workplace, therefore time to earn money. General trust factor is missing. Think about the involuntary sterilization events that occurred in the South throughout the majority of the 20th century. That's where a lot of the mistrust within the Black community towards healthcare stems from. Putting everyone first and not prioritizing themselves. We talked about the patriarch when we were discussing Black men. The matriarch role of the Black woman, and particularly the Black woman of a single parent household, in addition to even a dual parent household, the Black woman will tend to prioritize everyone and leave themselves last. To the right, we have a graph that shows three ethnic groups. In the gold, it's Black. The green is Hispanic, and the purplish is white. And it's the percent of children living with only their mother from the 70s throughout into this decade. And as you see, it's roughly about 50% of Black Americans living with only their mother, approximately 30% of Hispanic Americans that lives with only one mother, and 20% of whites. Next slide, please. Challenges of prevention, treatment, and recovery. There's this lack of understanding that addiction is a disease. It's not a moral failing. I often talk about no one wakes up and says, hey, I want to be an addict today. No one does that. But obviously, we know that there are many, many, many people that has a substance use disorder that needs to be treated. Sometimes they're separate and unequal prevention and treatment, such as having access to treatment. And sometimes the financial situation is a deterrent to that. It could be dealing with a geographical situation. Transportation could be a deterrent in terms of the closest treatment center of someone that's seeking treatment. Low income or being in a low income situation could also be one. Thinking about when we were talking about in terms of the Black women of either working or seeking treatment, could be one of those situations. As opposed to a high concentration of white Americans, there's more comprehensive treatment centers. Other challenges could be intergenerational substance use or polysubstance use. We always talk about breaking the cycle. How do we break the cycle? And when we talk about an SUD as a family disease, this is one of the ways. There's multiple ways, but this is one of the ways where it is a family disease. How are you going to break the cycle? How is the one in that family entity going to break the cycle? Community's lack of culturally responsive and respectful care. A patient's fear of legal consequences. We talked about that earlier. And issues created by poverty, which we also talked about, but lack of health insurance, untreated mental health disorders, or just a fear of judgment or gossip in the community. A lot of times within the Black community, people don't like to air their dirty laundry. So seeking treatment is another way of admitting your dirty laundry in some households or in some communities. It's also another way to, similar to what I mentioned about being a target, it's another way that will, or progression to achieving the American dream and whatever that American dream would look like for particular Black Americans. So just having that, it's like a chink in the armor. Next slide, please. These two graphs talk about the assistance that Medicaid's provided in gaining access to treatment. So the slide on the left, there's the blue line that talks about the number of treatment facilities throughout the decade of the 2010s. As you see, a very progressive increase with that. And along with that, the red line shows the number of facilities that is accepting Medicaid, which as we embarked upon the 2020s, it was a 1-to-1 ratio. The graph on the right talks about the uninsured rates among non-elderly Black individuals throughout the decade of the 2010s and into the 2020s, where it was 20% of non-elderly Black Americans who are uninsured. And then as you see the years, there's a progressive decrease of uninsured Black Americans because of the assistance of Medicaid to where it was below 2022 or below 20% as we reach 2022. Next slide, please. What can we do to improve care? For those who are providing treatment, whether it's from a medical perspective, from a behavioral health perspective, or even just from someone working at a service desk who's there to register a patient, whether it's an intake department or someone of that nature, that first contact, that first impression, that first encounter, it goes an enormous long way, particularly for them to return for their second visit. There's an customer service acronym that we adopt within BrightView, and the acronym spells out GREAT. And the letters in the acronym stands for greet, relate, explain, ask, and thank. I gave an example of the thanking piece a few minutes ago, but it's one of the principles that we adopt within our organization to ensure that not only that first encounter, but every encounter is being engaged with the GREAT framework. Part of that is also being present. It's not about the questions that you ask. It's just more about being present in the moment with the person that's seeking treatment. And talk with the individual, not at. One of my favorite things that other than hearing BrightView saved my life, my second thing that I love hearing our patients say is, you treat me like a human. You don't treat me like an addict. Or you treat me like a person. You don't treat me like an addict. That talks about how we talk with the individual, not at the individual. Nonverbal communication. Pay attention to your nonverbal communication and also read the room if there's multiple people around you or even just the individual. Are you showing through your nonverbal action, do you care? One of the things, and I do this without even thinking about it, but I've noticed it because it's been brought to my attention that, let's say if we're in a situation in one of my centers and I'm in the patient waiting area, also known as the lobby, and we have chairs there so that people are relaxed and they can sit down. It's very similar to a waiting area at any healthcare provider, your PCP or a dentist. And I like to go out and talk with patients, just find out how their treatment's going or if it's their first time coming to us. And what was brought to my attention, like I said, I do this without even knowing about it. I'll get on one knee because they're sitting in the chair, just so I can be on eye level with them. And it's one of those nonverbal cues that I don't even think about, but I ensure, I guess it's incorporated in my communication style with our patients. And if I'm not on one knee, I'm crouched like a baseball catcher just so I can get on eye level with them. Having that therapeutic approach, conveying softness or warmth as it's needed to ensure that the patient knows that the care is there. Not care in terms of treatment, but care in terms of, we're here to help you. Some of the questions that you're able to ask or that you should ask that will go a long way in that first impression. Is this your first time in treatment? How can I support you? What do you need from us? Our treatment process may seem a lot at first, but we are with you throughout, and I promise you, it will be worth it. These are some of the things that we can do to improve care. Culturally congruent care. It involves respect and consideration for the patient's cultural beliefs, their values, their practices. Part of that is having a knowledge and awareness. It requires communication and understanding, and part of that communication, that helps with the awareness as well. That communication between the patient and the healthcare provider. So if you are a provider or if you're involved with medical providers, how is the patient approaching the idea of treatment? It's one of the questions to ask. And if you can establish trust, you can affect the positive trajectory of a patient's life. Trust, we talked a lot about, particularly as you talk about Black Americans and Black Americans' experience, specifically hanging your hat on the American piece throughout our country's history. There's a lot of acts, there's a lot of events, there's a lot of treatment that creates a lot of mistrust, specifically in the healthcare, because that's what we're talking about today, in the healthcare system. Next slide, please. Education and awareness. We talked about awareness in the previous slide. It's one of the critical components of improving care. Building trust between communities and law enforcement, and that goes a long way. We've all heard about in various communities throughout our country that we're hearing police officers patrolling on foot more often or on bike more often to involve themselves more in the community. We've seen firefighters as well as emergency responders being on the streets in front of their houses, in in front of their firehouses, just to be visible within the communities. Those type of things build trust. It lets the community know that people are accessible, that they're not scary, because if you think about some of the things that we've talked about previously, there's some perceptions that in the Black community that they have with a lot of our first responders, particularly law enforcement. Well, law enforcement, that is not a positive image. It kind of goes both ways, but these type of community-based organizations or community-based activities, it helps go a long way. I'll even share a story about this, because the stigma or that perception or that stereotype with people that has an SUD, and this even goes off topic from Black Americans, but this is something that I've seen in one of our centers. There was a patient that had an episode that was inducting in one of our centers, and we called our local EMT, and hospitals very, very close to where the center is located. But this happened to be a situation where EMT was probably called 3 times within 3 weeks for various situations. And you can tell that there was a lack of care and even a lack of passion for the patient. And as the patient was being lifted onto the gurney, the patient was basically thrown onto the gurney and hit the ground. And as the patient got up, he was very violently turned and hit part of the doorway and hit their head, and then was tossed on a gurney again. And the center team, they determined and they figured, just because of the expression, because of the body language, because of the treatment, that they were just seeing this person as an addict and not a person. But the fact that it was an EMT, it created a barrier of trust within the community of our first responders and those that are seeking treatment. Increasing culturally relevant public awareness. Black communities are often focused on access to basic necessities and resources, not ads on benches or billboards. And many campaigns don't resonate in Black communities. I've talked to several of our outreach team members within BrightView, because even in our centers, it mirrors exactly what we're talking about today. There is a disproportion of the demographics of people that we treat compared to the demographics of the community that our centers are in. And what I've talked to our outreach team members about was to get into the Black community, go to the Black churches, talk to the church secretaries, or talk to the pastor of the church. And usually the church secretary is your pathway to the pastor. They usually play the role of the gatekeeper. Or go to your barbershops or your beauty shops within the Black communities and speak with the owners of the shops or the managers of the shops, because these are gathering places within the Black community. These are safe havens within the Black community. These are places of trust within the Black community. And if you're able to talk to the beauty or barbershop owners or managers or the church secretaries or pastors and let them know the services that you're able to provide for those who needs help with their substance use disorder, that's elevating that awareness. So as opposed to relying on those billboards or the bus benches, stating those type of things, getting involved in that community, talking to the people who talk to the people, has influence on the people. Those are effective ways that we try to make us a little bit more accessible to the Black community. Hiring diverse staff. I want to be seen by people who look and treat like me. I talked about that higher level of trust. It's the same type of thing. And it creates inclusiveness and a foundation for building that trust. Next slide, please. still involving education and awareness. Every community is different, and we all know that, but we must educate, raise awareness based on our understanding of the populations in which we operate. Develop multi-sector community partnerships to ensure a comprehensive network of resources. Resources is a critical key, in addition to the resource of having a place to seek treatment, involving resources as far as case management needs are concerned. Medication-assisted treatment and all treatment options are for everyone. Black communities need to know that these services exist, going back to what I was talking about regarding outreach team members that's involved with BrightView and the conversations that I've had with them and will continue to have. But these services are welcoming and they're diverse. Black Americans in the community should be the ones informing them of their options to promote acceptance, understanding, and non-judgment. Using that example that I gave with people involved in the church or people involved in the hair shops for men and women, it's they're influential figures. One, number two, they have the trust of the community, and that's why that's a really big avenue that our outreach team needs to travel to connect more with the Black community. Reconsider how we advertise treatment services effectively, investing in grassroots efforts instead of paid advertising. And what I gave examples of is definitely grassroots efforts. Next slide, please. A quote from the court system. I'm not the expert on addiction. I'm a criminal justice expert because I'm a lawyer and a judge. With no clinical background, it is very important that we have these partnerships and collaborate. This ensures the right people can help me stay in line with the best practices, use evidence-based treatment methods, and follow trends to help us address the issue of addiction. And that's Judge Nicole Sanders. Next slide, please. A quote from one of BrightView's very own patients. Like any other patient, Black Americans should be treated differently due to hereditary health conditions and economic injustices in treatment from the legal system. Many who went to jail before the treatment era are mistrusting of system and treatment programs, which ended up screwing them. Next slide. And I'm pleased to give another perspective. And the reason why I'm pleased is this is one of my all-time favorite poems, and the author is Jonathan Dickerson. And the poem is called I Ain't Got a Pencil. And what it talks about is things are not always what they seem. And it speaks to the challenges of the underprivileged that many will not seek to understand to establish a trusting provider-client relationship. And the poem goes as follows. I woke myself up because we ain't got an alarm clock. Dug in a dirty clothes basket because ain't nobody washed my uniform. Brushed my hair and teeth in the dark because the lights ain't on. Even got my baby sister ready because my mama wasn't home. Got us both to school on time to eat a good breakfast. Then when I got to class, the teacher fussed because I ain't got no pencil. It's pretty powerful. It's one of the reasons why I think that I say it's one of my favorite poems. It speaks to beyond the surface of the individual. The next slide. That brings us to our question and answers. And I will already thank you for your time and your ears. And we'll just open it up for the Q&A.
Thank you, sir. Yeah, thank you very much. And we also included a link in the deck that you'll receive to that poem. So very, very good way to kind of wrap things up, just to give everybody a different perspective. One of the other statements that kind of resonated with me is, yeah, every community is different. I mean, I know we have to present, data on national stats that we get, the most recent we can. And folks are concerned about their own community and how it applies there. And if we could do that for every community that tunes in, we would. Unfortunately, we're just not able to. But one of the first questions is, what is the best way to deal with colleagues or clients that unapologetically exhibit racial bias?
The best way that you deal with individuals that openly shows racial bias is through communication, through education in terms of enlightenment from the other person's perspective, and through respect. It's one of the things that's lost because it's such a high emotional topic that respect is sometimes lost when someone shows a biasness. But take it from someone like many Black Americans in our country, it's in your face almost daily, and you learn. It's basically the teachings that we've learned from Dr. King, from Mahatma Gandhi, that you rise above it and you take it from a light of communication, education, and respect.
Okay. And can you give an explanation of the cultural factors around Black Americans that make it more difficult to recover and or seek privilege?
I don't see it as a cultural factor. I see it more as a societal factor. I see it more as a historical factor. A lot of the plights of Black American, a lot of the challenges of Black Americans, it comes from the very first Black Americans who stepped foot in this country. Obviously, race is a hot button topic, and it has been throughout our history, and it goes back to the slavery days. So I think that historical factor and how that historical factor has impacted our American society throughout our country, because in various pockets, because we're at a point in 2025 where all of us are not treated equal. And those two things impacts the culture. So I see it more of a historical factor and a societal factor more so than a cultural factor. And I think we talked about quite a bit of that today.
Okay. One of the ones that came in via chat, do you have any ideas for sober support activities for minority individuals outside of NA, CAA meetings? What all would you count? Church, barbershop, hair, nail, appointments, family. How do you encourage pro-social activities and consistent participation?
For those who have a substance use disorder, is that where the question is going?
Correct. Yes. Yeah.
Okay. The biggest thing, and from what my experience has been, it's been involving the groups that you've talked about, the Narcotics Anonymous, the Alcoholics Anonymous, even Al-Anon. As I was being introduced, you all were informed that my passion to help those who are seeking recovery initiated with my brother's challenges with, and heroin was his drug of choice with his heroin addiction. And even seeing my mom question herself like a mom would, where did I go wrong? She got support, not necessarily from the community is what the person asked the question asked, but she went to Al-Anon, and that's what helped her a lot. So it is those substance use disorder based groups, treatment, support entities, even more so. And it's nice when you see people that look like you that's involved with it, but those shared experiences of either the others is what I call myself, my mom, family members, because those are people who are indirectly impacted, because we know that the one who has the SUD is directly impacted by that. But by the others, it's by dealing with those traditional type groups. And of course, you can find support elsewhere. I mentioned churches. Churches has some SUD support. Some churches has SUD support groups or interactions as well. It's just a matter of looking for things in the community. But I'm a proponent of your traditional ones, which is why I'm a proponent of patients who seek treatment with us is to be involved in a group. You gain so much more because it's your it's similar experiences that you have, but yet you're hearing it from other people. So it lets you know that there are other folks that has the same trials and tribulations as you. Long answer to a short question. I apologize.
Oh, that was good. Another one from an attendee. Every time the topics of cultural diversity comes up, it seems like everyone stays quiet. So once again, we go back to square one and don't make progress. How can we support or help our community if we as providers can't talk amongst each other?
I'm seeing that question as two parts, and I appreciate the ask. And I understand where you're coming from when cultural diversity is being mentioned. But if you think about it, the United States of America, we were founded on cultural diversity. We were founded on different diversity of religions, nationalities. We're not called the great melting pot for nothing. It's one of our greatest gifts, and it's also one of our biggest challenges as a community. So I actually don't see diversity as a deterrent. I see it as it's one of our greatest gifts. So when you're talking about it from a medical provider, and if a provider is of a different ethnicity of someone that they're treated, regardless if it's black to white or whatever the case may be, that's where the conversation and seeking to understand, that's where that takes place. So it's just taking it on an individual basis as the person is being treated and to find more about the person so that the treatment can be successful.
Do you have any suggestions for person of color focused resources on medication for addiction treatment? In our rural areas, I find that Black communities are the most suspicious of harm reduction and MAT because of the trauma and systemic oppression that you outlined.
Can you repeat that one more time, please?
Yeah, no problem. Do you have any suggestions for person of color focused resources on MAT? In our rural areas, I find that Black communities are the most suspicious of harm reduction in MAT because of the trauma and systemic oppression that you outlined.
I'm smiling because it's not just the suspicion of Black Americans or even a Black community regarding medication-assisted treatment. There's a stigma that's attached to that, and take it from someone who works with an organization that provides medication-assisted treatment, is a lot of people look at it as a drug chasing a drug. And some people think, just like my brother, he went through Narcotics Anonymous, he had the philosophy of abstinence. That's the best way of seeking recovery. It's part of that education piece of why medication assisted treatment can be successful for the individual. And it's definitely on the individual. They can seek their own type of treatment. That's the beauty of this. And one of the slides talked about, in addition to MAT services, that there are several treatment options out there. But it begins and ends with education. Obviously, this has been a theme besides of Black Americans and the challenges of seeking or getting treatment for their SUD. But education is a huge piece. It's letting people know the benefits of MAT services or why MAT services are being provided.
That's great. These are some great questions, everybody, and I also appreciate everybody providing feedback. Please do so in the survey as well. But another question is that someone that works in a prison, she notes that they utilize punitive measures and mandates for it mandates some substance abuse programming, but they also have voluntary IOP as well, but feels that the punitive measures create not only a distrust among the population of inmates, but a lack of engagement for many who desperately need it. This person doesn't have the power to change this, but would like to change the attitudes of the justice involved folks. How can I do that when we have a 99% white staff and a 99% Black inmate population? How do we make them not feel like they're being oppressed further? Two things before I hand off to you, James. One, we are actually looking at addiction treatment with the justice involved, where I think a little bit of that will probably be addressed a little bit more thoroughly. But above and beyond that, this is definitely, we're starting to see a tale of two cities when it comes to law enforcement. There are definitely law enforcement and, prison, state and federal, that are seeing this as an opportunity to get their inmates to become contributing members of the community, right? So while we're definitely seeing the experience that you're sharing, to the person that asked this question, we are making progress there. I think folks are realizing that if punitive measures worked, we wouldn't have drug addiction today. So anyway, I will hand off to you, sir.
I appreciate it. I appreciate you setting it up. Another part of it is it has to be a philosophical change within that incarceration system or that prison system. We have a harm reduction philosophy that we prescribe to at BrightView. And simply what that means is we will not put our patients in any type of situation that will cause them to use. And usually in a punitive situation, that will create a situation where someone will use. So that's a huge lift to change the dynamic, to change the culture of that system, but it has to be done at a philosophical level and then executed from there.
Awesome. Another question, and we had kind of talked about this amongst ourselves prior to the presentation based on, a lot of different current events, but with increasing unapologetic white nationalism, how do we protect the mental health of Black clients and practitioners in diverse environments when in society it appears tolerance for diversity and a willingness to be educated about the benefits of equity and inclusion are on the decline?
In some pockets. Obviously, this gathering does not speak to that, but I definitely understand what you're talking about. I grew up in Columbus, Ohio, and one of the things that has been shocking to me is in the middle of the city, and there's an area called the Short North District, which is a pretty big commerce area, restaurants, social gathering places, things of that nature. And there's been Proud Boy demonstrations and marches throughout the streets of the city that I grew up in. And you talk about shocking. And we live in a country where we have a right to demonstrate. Therefore, it was a peaceful demonstration. It was just the march, but I truly can't answer that. I can just talk about that experience, and I haven't seen it up close in person, but I think there's strength in numbers when you're involved in that. And I think the more that, as the questioner asked about that divide, I think that it's causing more people to gather together. I'm not sure but it mentioned this on my bio slide, but I'm also the chair of our Diversity, Equity, Inclusion, and Belonging Council at BrightView. And I've had a reach out over the past month from team members throughout our organization asking about my opinions or thoughts about what's been going on with some decisions. And I don't want to make it about politics, but it's something that we're living in right now. But it's that gathering of people coming to me just because of my seat on the DEI&B Council. It tells me that people want to be with each other as opposed to be separate from each other. And this has been people from different races, ethnicities, nationalities, creeds, whatever the case may be. And that's been rewarding to me to see that. And one thing that I'm hanging my hat on is our basic values of human beings. That's one of the things that I have faith, and it may be blind faith, but I have faith in carrying us through.
I would add to that as well. I mean, we discussed this very question, Julian, prior to giving it. And, I think the answer to it is continue to speak up, continue to learn. That's why we're presenting this presentation, this webinar, and continue to raise awareness. And if you see something, speak out. I think it's not stopping because of these reactions is critical. I think that's what folks might be hoping will happen, but we just have to be vigilant and resilient about it. And someone else is asking if I wanted to begin this conversation, where would this type of conversation, where would I begin? James?
It depends. You can start it with a question, and everyone's open to a question. So if it's a situation where you're seeking understanding, or if it's a situation where you think that it is a culturally deterring situation, as what Kevin just mentioned, you can speak up. So it depends. It depends on the situation and the place where you're coming from with it. But going back to the answer that I gave regarding communication, education, and respect, always make sure that that's the underlining tone, because this is a powder keg of a topic that we're sitting on. But once you anchor yourself in the communication, education, and respect piece, it can be a very powerful conversation. It can be a very enlightening conversation.
Destiny, to your point, your question earlier about justice involved and how do you affect change there, Dakota Lewis just shared a really good experience. I'll read here. She worked for the drug court system in District 40 of Virginia as a peer recovery specialist. She was able to talk directly to the judge and Commonwealth attorney and explain to them that jail time because of an SUD problem does absolutely nothing to help treat the actual problem. The judge, heard her, took her words of value, and started leaning more towards treatment over incarceration. So again, I think that kind of gets back to what we've just been talking here about from a broader perspective of, speak up, help raise awareness, and continue to raise your own awareness, if you will, through things like this.
It's a wonderful story.
It is. Yeah. Thank you for sharing, everybody. This has been great.